I decided to become a nurse because I felt a calling to really uplift and protect the dignity of people, particularly when they are in the hospital or patients. And that's sort of my philosophy as a nurse, is to treat every patient, as a person, and to really empathize with them and care for them. I actually was a COVID nurse last year during the pandemic, 2020, and I cared for patients that were COVID positive in the PCU at Sharp. And back then, the vaccine was just starting to roll out. It was definitely a challenging time, and I, like patients and everyone, had a lot of questions about it, but I have been vaccinated, and I encourage it for those that don't have any contraindications to it. And I got to experience COVID very closely in my family because my grandmother passed away last year due to COVID. And so I've seen it up close, and I've seen the toll that it has also in the entire health system. I see it, how it's affecting us outside of work and affecting every person. It was a very difficult time, for sure. However, looking back, I am grateful that I had the direct experience with COVID patients, and that I knew how we were treating them, what we were doing, what the progression of the disease looked like. And so when my grandmother was in the hospital and not progressing, I was prepared to have very difficult conversations with my family. And had it not been for me being a nurse and being specifically working in a COVID PCU, I don't know that I would have been able to do that in the same way. And so I'm grateful for those difficult experiences.